name is Sydney Ferrell, and I'm a student nurse at the University of Arkansas at Monticello, and I'm here to do your head-to-toe assessment. Can I get your name?
Ferrell-Jalovec.
Your age?
25.
Your race?
Caucasian.
Your gender?
Male.
Can I get a good telephone number for you?
870-222-7161.
Okay, and a good address.
145 Wainwright Lane.
Alright. Can I ask you what is coming... Can I ask you why you're coming here today?
I am having a lot of pain in my knee.
Okay. Do you know when this first started happening?
Yes, it happened sometime last week when I tripped over a pile of bricks.
Okay. So this is going to be on your right knee?
My left knee.
Your left knee. Okay.
Ow.
So this has just been happening for about a week now?
Mm-hmm.
Do you know what type of... Is it more like a throbbing pain, sharp pain?
Yes, it's very sharp.
Okay. Do you know whenever it starts happening, just like whenever you're just walking, just more at night?
Yeah, just whenever I'm walking, kneeling, squatting, all that stuff.
Okay. Have you done anything to try to relieve your pain?
Just Tylenol.
Okay. From on a scale of maybe 0 to 10, 0 being, not much pain, 0 pain, to being 10, the most pain you've ever had, what would you
I'd say
rate
it's
it?
like a 5 or 6.
Okay, so it's pretty significant.
Yeah.
Okay. Alright, Mr. Jalovic, I'm going to ask you a few questions about your past medical history. Have you had any major adult or childhood illnesses?
No.
Are you caught up on all of your immunizations?
Yes.
Do you know the date of maybe your last tetanus shot?
Probably sometime 2014.
Okay. Have you had any serious injuries maybe in your past?
No.
Any type of hospitalizations?
No.
Any surgeries?
I had eye surgery as a kid.
Okay, on which eye?
My left eye. Actually, they did both eyes.
Okay. And do you know the date or just maybe the year of your last health exam?
2017.
All right. Have you had any screenings lately, or do you go through any type of routine screenings throughout the year?
No.
Okay. Do you have any major allergies?
No.
And I want to ask you, have you had any emotional problems in the past, any type of mental illness
No.
that you've dealt with? Okay. Now I'm going to ask you about your family history. Can I get maybe the age and health status of any immediate family?
I have a 23-year-old sister with hypertension.
Okay. So, other than your sister, have you had any family members with a history of heart disease, lung disease, kidney disease, thyroid?
No.
Okay. Anybody else in your family with hypertension? Or
my dad did have high blood pressure when he got up in age.
Okay, so just whenever he got up in age.
Yeah.
Okay. Any stroke, cancer,
No.
tuberculosis, diabetes, any sort of...
No.
Okay. All right. So now I'm going to ask you about your personal social history. So I want to move right here. Excuse me. Can I get your where you were born?
Monroe, LA.
And what do you do for a living?
I am an enumerator for the census.
Okay. What is your family structure? What type of do you live in a one family home, couple family home?
It's just me and my wife.
Okay. So you're married?
Yes.
Okay. Any hobbies that you have or you enjoy?
I enjoy playing saxophone and guitar, and I like going fishing.
Okay.
So.
Is there anything that causes stress for you day-to-day life?
No.
Okay. I'm going to ask you about your health habits, or you can describe them to me, maybe about your diet, or maybe what you eat in a day.
I could eat a lot better.
Okay. So do you try to eat better, or you just kind of eat?
Just whatever I want, whenever.
Okay. Do you ingest any alcohol or tobacco products?
I have a few beer on the weekends.
Okay. And do you partake in any type of recreational drugs, such as maybe marijuana?
No.
Okay. And do you drink any type of sugary drink that maybe include caffeine?
Diet Coke here and there.
Okay. I want to ask you about your sexual history. Can I get the number of partners that you've had?
1.
And do you use any protection?
Yes.
Okay. And do you have any feelings or maybe any type of concern about performance at all?
Absolutely not.
Okay. Your home environment, do you feel like you live in a safe home environment, a healthy home environment?
Yes.
Do you have any pets?
I have 3. 2 pups and a cat.
Okay. Do you travel a lot, or when's the last time you have traveled?
No, I don't travel much.
Okay. Can I get your religion, or your religious preference?
Christianity.
All right. And do you have any preferences that come along with any type of culture that you indulge in?
No.
And do you perform any self-care exams, or such as maybe checking for testicular cancer when you're on, or anything?
I just kind of check myself every now and then before I get in the shower.
Okay. And what is maybe the access to healthcare that you have? Are you able to go to the doctor whenever you need to, go to the hospital?
Yes.
So do you have good transportation?
Yes.
And do you have any insurance?
Yes.
Okay, that's good. Next, I'm going to do a review of your different type of systems in your body.
Okay.
What do you believe your maybe general health status is?
Probably moderately healthy. I believe I could do better with my diet, but...
Okay. Maybe describe your skin. Do you have any problems with itchiness, dryness, any rashes, sores that don't heal very well?
No.
Any changes in maybe color, any discoloration anywhere?
No.
Okay, so I'm going to ask you about your hair now. Have you noticed any hair loss?
No.
Or any problems with distribution, maybe some type of balding pattern anywhere, discoloration?
No.
Okay. Do you use any chemicals on your hair at all?
Just shampoo and conditioner.
Okay, so no harsh chemicals on your
No.
hair? Okay, so about your nails, have you noticed any splitting, breakage,
No.
unusual thickness,
No.
discoloration, any type of separation maybe from the nail from the bed?
No.
And have you had any fungal infections or anything?
No.
Okay. Okay, let's see. Have you had any injuries to your head or anything in the past or recently?
No.
Okay, so you haven't taken any nasty spills?
No.
Alright. Do you suffer from any dizziness, loss of consciousness?
No.
Any bad headaches that you can't really explain?
No.
Fainting, or swelling or pain maybe through here?
No.
Okay. Have you noticed any visual changes, such as maybe loss of vision, double vision, maybe blurred vision?
No.
Alright. And have you noticed any itchiness of your eyes or any pain or drainage that can come from here?
No.
And do you wear any glasses or contacts, or have you ever worn those
No.
things? Alright. Have you noticed any tinnitus or ringing in your ears?
I do get ringing in my ears.
You do? How often do you get the ringing in your ears?
At least once a day.
And how long has that been going on?
For the last few years.
So, I mean, it's pretty significant.
Yeah.
Okay. Any hearing loss?
Yes. I think that is mostly due to the loud environment I worked in at the mill.
Okay.
My last job.
Alright. Any type of earaches? Do you get them a lot? Have you had them a lot?
No.
Okay. No dizziness concerning your ears. Maybe if something happens with loss of vision, you can get maybe unstable. Loss of vision. Loss of hearing can be unstable. You know, your balance could be off.
No.
Or anything like that? Okay. And do you use any hearing aids or assistive devices?
No.
Such as hearing aids. Alright, so with your nose, have you noticed any discharge, any congestion
No.
in your nose? Maybe sneezing, snoring
No.
that you've noticed? Do you get any nosebleeds?
No.
Or have any obstructions in your nose?
No.
or any type of pain with sinus, which could be right here?
No.
All right. Have you had any loss of teeth or any breakage of your teeth?
No.
Do you know if you grind your teeth when you sleep, or maybe just whenever you're, not really thinking about it?
No, I don't.
Okay. Do you use any dentures or anything, fake teeth that you can just, pop in?
No.
Have you noticed any random mouth odor? Just kind of comes about?
No.
And have you had any difficulty swallowing?
No.
Or dryness of the throat?
No.
All right. And I'm going to ask you about your lymph nodes. So throughout here, your lymph nodes, have you noticed any pain, tenderness, felt any kind of nodules or anything throughout here that you've kind of noticed that is painful?
No.
Okay. And I'm going to ask you about your chest and lungs. Have you had any shortness of breath?
No.
Or coughing, maybe on exertion, maybe getting out of bed, getting up from a chair, you kind of feel short of breath and you have to catch your breath?
No.
Have you had any coughing up of anything?
No.
Okay. Any type of, maybe whenever you're laying down at night, do you feel like you can't breathe as well? Like
No.
when you're laying on your back?
No.
And I need to ask you, how many pillows do you sleep with?
Usually just one or two.
Okay. So nothing significant?
No.
All right. Have you ever had a chest x-ray?
Yes.
Okay. Do you know when that was?
That was around 2017.
Okay. I want to ask you about your breast. Have you had any pain or tenderness or any drainage from
No.
them? Okay. Have you had any swelling in your extremities, like in your legs or your arms? Anything that just really kind of wouldn't go away or come out of nowhere?
No.
Have you noticed you having clammy skin?
No.
Have you ever had heart palpitations?
No.
Okay. And whenever you exercise, or if you exercise, maybe what's your tolerance? So, like if you're walking up a flight of stairs, or if you're just, walking down the road, doing any type of physical labor, do you feel like it gets harder?
No. I walk all day.
Okay. Have you, or do you have, or have you had the tendency to bruise or, bleed very easily?
Nope.
Have you had any maybe varicose veins or anything of this
No.
sort of thing, like the spider veins is what they call it?
No.
Okay. Have you ever been anemic?
No.
Have any blood disorders of any kind?
Nope.
So what's your appetite like? Maybe how many times do you think you eat a day? Or do you get hungry easily? Is it kind of hard to make yourself eat?
I'll probably eat about 3 meals a day.
Okay, so just kind of regular.
Mm-hmm.
Have you had any just trouble swallowing or any pain with swallowing?
No.
Do you get indigestion very often, or any type of acid reflux, heartburn,
No.
any nausea,
No.
vomiting? Have you ever had blood whenever you have had to go and vomit before?
No.
How regular are your bowel movements? Do you go about, the once a day or so?
About once a day.
Okay. Have you had any trouble with any constipation or diarrhea?
No.
Have you noticed a change in your stool? Just maybe blood in your stool?
No.
Any type of just weird colors?
No.
Or anything? Do you get any cramping?
No.
Ever? Have you had an encounter with hemorrhoids?
No.
So no bleeding
No.
from down there? Ulcers?
No.
Okay. Have you had any tumors, gallstones, anything of that
No.
nature? Have you noticed any enlargement in your thyroid, which is about right here?
No.
And no pain?
Mm.
None of that? Have you noticed any type of heat or cold intolerance?
No.
Like the temperature? Notice any just unexplained weight gain?
No.
Or diabetes?
No.
Do you have the urge to urinate very frequently?
No.
Do you have any hesitancy to use the bathroom?
No.
To urinate? Okay. Have you noticed any changes in maybe facial hair, like the the pattern or the amount?
No.
Has thinned out, thickened? No.
No.
Okay. All right. And have you noticed any type of loss of your urinary stream, maybe?
No.
Or the flow, or it hasn't gotten just stronger or less, or
No.
anything like that? So any dribbling?
No.
Do you urinate more at night, or have you noticed you having to get up to use the bathroom during the night a lot?
No.
Have you had any burning
No.
while using the bathroom? Okay. Have you noticed any pain here in the pelvic area, the flank, the abdomen, anywhere around this area, any type of pain?
No.
Okay. And have you had any problems with blood or having very dark urine?
No.
Okay. I want to ask you, when did you start puberty, or around the time maybe you started puberty, around the age?
Around 13 or 14.
13, okay. And have you had any problems with infertility?
No.
Do you have any difficulty with erections,
No.
arousal, okay. And have you had any testicular pain?
No.
Okay. And have you had any joint pain or tenderness maybe through here in your knees? That could be maybe related to joints. So, whenever you're moving, getting up and down, does it hurt, or is it just from impact?
Yeah.
Okay. And do you have any swelling, heat, other than your injury that happens
no.
in your joints?
No.
Have you noticed any bony deformities throughout anywhere on your joints,
No.
knees, hips? Okay. I want to ask you about your more neurological state. Have you had any seizures?
No.
Do you feel any weakness?
No.
Loss of feeling maybe in your extremities, any type of paralysis?
No.
Loss of memory, short or long term?
No.
And so you said you don't have any abnormalities with your coordination, with how you walk. You feel like you're pretty steady and you're okay. You're not going to fall over.
Yeah.
Everything. Okay. And last question, I'm going to ask you about, have you had any depression lately, mood changes?
No.
Anxiety? Do you get irritated
No.
very often or agitated very often? Are you okay sleeping?
Yeah.
So you can pretty much get a full night's sleep and be okay.
Mm-hmm.
Nothing kind of keeps you up at night. And last question, have you had any suicidal thoughts?
No.
Okay. Well, that is it for the interview. And I'm going to go wash my hands. And I am going to start the head-to-toe assessment, if that is okay.
Okay.
All right. So I'm going to inspect the skin and the characteristics of your skin to see if there's any dryness. You tell me if you have any tenderness.
Okay.
Or anything is sore. So I'm going to check here on your head first, in your face, and see if there is anything. I'm going to palpate the scalp and feel for any lumps or anything. So there's no tenderness, soreness.
No.
Okay. And okay, see your face. Okay, looks good. Next, I am going to palpate the temporomandibular joint. So I'm going to put my hands right here, and I want you to just open and close them for me. Okay. And next, I am going to check your range of motion of these of the temporomandibular joint. So what I want you to do is I want you to laterally move your jaw. So can you do this 2 times each? Okay. Can you protrude your jaw and then retract it? Okay. And this is I'm going to check the cranial nerve, the 5, which is the trigeminal. And I'm going to put my fingers here, and I want you to just clench your teeth. Okay. Next, I am going to palpate your sinus. So I'm going to put my fingers here. And there's no pain, tenderness?
No.
Okay. Just going to feel for any type of nodules. Okay. And next I'm going to check for the cranial nerve 7, which is the facial. I'm going to move this chair out of the way. Okay. So what I want you to do is, can you raise your eyebrows? Wrinkle forehead. Okay. Can you give me a smile? Show me your teeth. Can I get you to purse your lips like this? Puff out and blow your cheeks. Thank you. Okay. Next, I'm going to check your eyes. So first I'll do this. Okay, so I'm going to look at the sclera, which is the white of your eyes, and make sure there's no discoloration of any kind. Okay, and I want to check your iris to make sure there is no type of deposits or anything. You haven't had any problems with your eyes like you said?
No.
Okay. Now I'm going to check your conjunctiva. So I'm going to put my fingers right here, and I'm going to pull down, and I want you to kind of look up. Okay. They look good. Alright. So next I am going to check your pupils for the reactivity to light. And this is going to be direct and consensual. So what I'm going to do is I'm going to put this light on this eye, and the other one should constrict as well. And then vice versa. I'm going to do it on the other eye and then watch the other one. Okay. Now it's maybe a little bright. Okay, so that one constricted good. Alright, so I'm going to go to the other one. Alright. Sorry about that, sir. Okay, and now I'm going to check the 6 cardinal fields of gaze. And this is going to check for the cranial nerve 3, 4, and 6. And that is the ocular motor, trochlear, and abducens. So what I'm going to do is I got my pen light. And I want you to just follow it wherever it goes. Don't move your head and neck. Just follow with your eyes, okay? Go here. Okay, very good. Next, I'm going to look at your pupil size. Okay. Say you're about a 4 on that one. I'm just going to make sure they're about the same size. Yeah. Okay. Next, I'm going to check the accommodation, which is still for 3, 4, and 6. So what I'm going to get you to do is I'm going to bring this pen light, and I'm going to bring it in toward the bridge of your nose. And I want you to follow, and I know it may feel uncomfortable, but your eyes should cross. So after I get done with that, I want you to just look back here at that door, and I'm going to make sure that everything goes back to where it is. Okay? So look at the pen for me. Just follow it all the way in. Okay, now look over there. Okay. Alright. Next I'm going to look at your ears and the alignment and the placement of them. So I'm going to inspect this. So can I get you to put your head down just a little bit? Just kind of. Okay. You look in alignment. And I'm going to check your ears. So I'm going to palpate the auricle, which is the whole ear. I'm gonna make sure there's no tenderness, pain.
No.
Alright. Okay. So next I am going to check the alignment of your nose, and I'm going to look at your septum, and then I'm going to do something called a patency test. So first I'm going to look at the alignment. And if you don't mind, I'm going to look at the septum and make sure there's no obstructions or anything like that. do what is, like I said, the patency test. So I want you to close your nose like this, and then blow out one side, and then the other side. Okay. And then I'm going to go and I'm going to check your ears for something called the whisper test, which is cranial nerve 8, which is the acoustic. So what I'm going to get you to do is I'm going to get you to close one of your ears, and I'm going to step behind you like so, and I'm going to whisper 2 words. And I want you to just recall them back to me. That's all you got to do. And then we'll do that for both ears. Okay.
Sunny day.
Okay. Next ear.
Say high school.
Mhm. All right. Now I'm going to inspect your lips and the inside of your mouth, gums, teeth, floor of mouth. Okay. Yeah. I'm gonna get my tongue depressor here. So first I'm just going to look at your lips and make sure there's no cracks or anything. Have you had any problems with cracked lips? Any type of chapping?
No.
Just, okay. Alright, so if I can get you to open your mouth. I'm going to look for any type of ulcers on the inside of your mouth. Have you had any problems with ulcers in your mouth?
Mm-mm.
Okay. Alright, look at the buccal mucosa. Kind of look at your gums. Okay. Alright, so I'm going to get you to lift up your tongue for me so I can look at the floor of your mouth. I'm looking for just different, just discoloration, any type of lumps or any type of things like that. Okay. And so now, can I get you to open just a little wider? I got to look at and kind of look up because I got to look at the hard and soft palate, which is on the roof of your mouth. Okay, and then the anterior posterior pillars, which is it's right here in front of your uvula. And I'm going to get my light, and I need to look at your tonsils as well. Just put your tongue down for me. Thank you. Alright. And now I need to check the range of motion of your tongue. So can I get you to stick your tongue out for me, like from side to side? Okay. And that is checking the hypoglossal nerve, cranial nerve, which is 12. I got something over here for you. This is to check the glossopharyngeal nerve, and I need you to just swallow.
Mm-mm. No, not that.
This is your Diet Coke.
No, I haven't finished one.
Get water.
Not drinking old Diet Coke.
Okay. And next, I need you to just stick out your tongue and say ah. Alright, and that's to check the vagus cranial nerve 10. Let's put this over here. Okay. And next, I'm going to check your neck for jugular vein distension, any type of thyromegaly. So you said you have not had any inflammation or enlargement of any type of your thyroid?
No.
Okay, and I need to check your range of motion and strength of your neck. So this is the flexing arm position. So can I get you to do this? And then hyperextend, which is bringing your neck all the way back. And the lateral bend is when you go from right to left. So just right. And then I want to check your strength. So Can I get you to just kind of go against my hand here? Just move your, yeah. And then this one. Good. Okay. And then I want to check your rotation. So just instead of bending this way, just turn your head from left to right or right to left, whichever one. Okay. Now I'm going to check cranial nerve 11, which is spinal accessory. So I want you to shrug against my resistance. Okay. And I'm going to palpate your carotid pulse. And so I'm going to do this one at a time. Okay. All right. And now I need to check your tracheal position to make sure it's in midline. So I'm going to do this right here. May feel a little discomfort. Alright, now I'm going to get into the inspection of your upper extremities first. So I'm going to look at your shoulders, arms, hands, fingers, and make sure there are no type of problems that we should be looking at. So I'm going to inspect for dryness. You let me know if there's any tenderness or any pain. I'm also looking for edema, swelling. Have you had any swelling, like you said? You did not, yeah?
No.
Okay. Alright. Get you to turn your arm for me. Alright, so while I'm here, I'm going to also inspect your nails, and then I'm going to check something called the capillary refill. So first I'm going to inspect your nails. For any brittleness, breaking?
No.
Alright, so next I'm going to do the capillary refill. So I'm just going to relax your fingers for me. And I'm going to take one, and I'm just going to kind of flick it and make sure it goes back down in a reasonable amount of time. Okay. I'm going to do the other arm. Check your shoulders. So for any lesions, wounds, abrasions. Okay. No joint pain in any fingers. Okay, I'm gonna check this arm with these nails. Okay. Now I'm gonna check capillary refill in this hand. Alright. Okay, so next I'm going to check your radial and brachial pulse. So I'm going to check it on each arm. This is your radial pulse. Just make sure it's there. And now for the brachial, I'm going to take your arm right here. And I'm going to maybe turn it just a little bit, and then I'm going to feel. Okay. The other arm. Alright, next I'm going to need to test the range of motion for your hands, fingers, wrists, and your shoulders. So for your fingers, I just want you to go, this is called the flexion position for your fingers. I want you to just mimic me. Just put them, kind of, yeah. So that's flexion, and then just hyperextend. Okay? And next, I want to check the same thing, but for your wrists. So this is flexion, and then just extend to the hyper. Okay? And we're gonna move to the shoulders. Actually, I want to test the range of motion of your fingers. So with this, you can take your thumb to your pinky finger, like this, and then just kind of like you're counting. So go from small all the way here, and then all the way back. Okay? And can you just make a fist? Alrighty. Next, I'm going to get you first, before I do the range of motion on your shoulders, I'm going to go ahead and test your shoulder strength. So on each arm, I'm going to take it. Here, you can just, like this. And I want you to just kind of pull against my resistance, okay? Okay. Same thing on this arm. Okay. And then I want you to stick out your arms like this in the flexion position, and then I want you to come up like so. Okay. All right. Next, you may want to stand for this one. I'm going to get you to check the rotation, or I'm going to check the rotation of the inter and exterior of your shoulders. So what I want you to do is you're going to take this arm and you're going to come back in like this, okay? Yeah. So like this, and then other arm. All right, and then you're going to take this arm and you're just going to come up like this behind. Okay. And then other arm. Alrighty. And I think that's it for the upper. Next, I'm going to check your back for chest and lung sounds, and I'm also going to inspect your back and then look for the thoracic configuration, which I will let you know what all this is. Which tear do you think you would feel most comfortable in? Okay. So for this, you're going to have your shirt and your back exposed.
Is that enough?
Maybe a little more. Okay, so can I get you to turn to the side here for me? Okay, so I'm going to just inspect your back for any type of lesions, wounds. Okay. Have you noticed any type of random or anything that concerns you about any of these freckles or moles or anything back here?
No.
Okay. All right. So first, I'm going to do your thoracic configuration. So I'm going to put my hands like so, and I just want you to give me a good deep breath. Okay, one more time. All right. Now, I'm going to check you for something called tactile femotis. And I'm going to go along your spine here. And every time I sit my hands down along the spine, I want to get you to say 99. And this is going to kind of vibrate, and this is the best, maybe a little odd, but taken for crepitus or anything of that nature, okay? So you ready?
Yep.
Here you go.
99, 99, 99, 99, 99, 99,
Alright. And I'm going to check for kidney tenderness. So I'm going to locate your kidneys here. Alright, I'm just going to kind of hit it just real quick and just tell me if there's any tenderness or pain, okay?
No.
None?
No.
Okay. Alright, next I'm going to listen to the back of your lungs. Okay. So every time, whenever I put my stethoscope down, just give me a good deep breath in and deep breath out, okay? 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Okay. I'm going to go ahead and do the other breath sounds if that's okay.
Mm-hmm.
Alright. 11. 12. 13. 14. 15. 16. 17. And 18. Okay. You're good. All right. Next, you can look around now, and I'm going to have to check your chest for heart sounds, inspect your chest just like I did the back. Okay. I need you to lift up your shirt. Okay. So first, I'm going to inspect the skin for any type of, like I said, abrasions, lesions, bumps, lumps, anything like this. Okay. Okay. And have you had any concern with this bump right here
No.
before? It's
No.
just kind of
It's been there for years.
been there? Okay. Alright. Well, I can go ahead and finish your lung sounds on the front. Alright. So here we go. 19. 20. 21. 22. 23. 24. 25. 26. Okay. All right. So next, I'm going to listen to your heart, and I'm going to have you lean forward in your chair. Okay. So I'm going to listen for the aortic, which is over here. The first pulmonomic. Your second pulmonomic. Your tricuspid. And then your mitral. Okay. Can I get you to stand up for me for just another second? And I want to look at your posture, so if you can just kind of stand like this. Okay. And I'm going to come to the side here, and can you give me a big breath? Okay. Next, I'm going to get you to come lay over here for me. Gotta move this stuff out of the way. Okay. Let me move the camera real quick. Just make sure it's in alignment here. Yeah, okay. Let's see. Now if I can get it to stay. I think that'll be. No, I need to get a little pointed more. Let's see. There we go. Hopefully. No. Here, I'll move all that
You can
out.
put it right here if you need to.
Yeah, it'd probably be a lot better. Alright, Miss Hogue. Yeah, definitely. Okay, I just gotta get something to put it. Not having a good enough room here. Jesus. I have to move around here. That's actually the best thing. Okay, yeah. Alright. So I am going, see if I get in the shot here. Okay, so I'm going to inspect the skin on your abdomen again, just to make sure, and I'm going to look for like contour, just symmetry, making sure there's no distension, which could be, you know, that could be a factor for, you know, tumors or anything like this. And so I'm just going to make sure that there's nothing there to worry about.
Okay.
So can I get you just to raise your shirt? Okay. Well, first, yeah. Just going to inspect here. Okay. Alright, just make sure everything's in midline. And then now I'm going to listen to the sounds of your abdomen. Okay. And I'm going to listen to your right upper quadrant first. So it's over here. And then your left upper. Your left lower. and your right lower. Then I'm also going to listen to your aortic space, which is right here. And this is just to make sure there's no, weird sounds or anything, such as bruit, that we have to worry about.
Okay.
Okay. So you can just breathe normally. Okay. All right. So next, I'm going to get you to kind of raise your head, kind of like you're doing a crunch, and I'm going to watch the muscles in your abdomen, okay, just to make sure there's nothing out of place. All right, so you can just raise your head. Okay. All right, you can put your shirt down now, and I'm going to palpate your legs and your calves and your feet and your toes, just to make sure there's nothing. And I am going to also test the range of motion here in a second. I honestly want to make sure this camera is pointed down there so you can see me. It was not. Okay. There we go. Alright. So, I'm going to feel for any type of edema, any type of swelling, heat. You just let me know if there's any type of tenderness, and on your left knee, let me know if I hurt you, or maybe where exactly on the knee?
Right there.
Right here?
Mm-hmm.
More on the inside?
Yeah.
Okay. Alright, I'm not going to put as much pressure on that then. I just wanted to make sure. So I'm going to go from each leg, and I'm just feeling for heat. Like I said, let me know if there's any tenderness or anything. I'm also going to check for capillary refill like I did on the fingers for the toes. So you can just relax, just try not to tense up, okay? Alright. And the texture feels good. Alright, so I'm just going to take each toe, and I'm just going to do it just like I did the finger. Good. Okay, so Mr. Jalovic, I'm going to try to be very, very careful around your knee. Does it hurt all the way in the back, or is it just strictly right here and maybe the dip of your knee?
Yeah.
Just in the dip of your knee? Okay. Okay, but everywhere else is fine?
Mm-hmm.
Okay. Alright, next I'm going to get you to test the range of, actually first I want you to test the strength of your foot for me. So I'm just going to put my hand, and I just kind of want you to just, like the shoulder, just kind of go against the resistance, okay?
Okay.
Alright, now you can get up. And I'm going to test the dorsiflexion and the plantar flexion of your foot. So what you're going to do is you are going to take your foot, and you're kind of going to, I'm going to move this back up here. Okay. You're kind of going to go down with your foot and then back up. So that's dorsiflexion, and then that's plantar flexion. Okay, so next foot. Dorsiflexion, plantar flexion. Okay, good. Okay, so next, you can come sit back over here if you would like, or if you want to stay over there, just wherever you're most comfortable. That's fine. Okay. That's great. I wish I could get it this out. Okay, set this back up here. Okay. So So next I'm going to check for superficial touch. And so what's going to happen is I have this, my cotton swab here, and I want you to close your eyes. And so what I'm going to do is I'm going to just randomly touch from your head to your legs, okay? And just kind of describe it. Let me know if you can feel it, okay? If there's any numbness, let me know.
Nope, just tickles all the way down.
Just tickles?
Mm-hmm.
Okay. It's okay to laugh. Okay. But you felt all of that. There was no numbness or anything. No. Okay. Alright. So next I'm going to try this sharp and dull test.
Okay.
And these are for the trigeminal nerve, which is 5, okay? And so what I'm going to do is I got a blunt end. And I've got a kind of a pointing end. It's not going to hurt. I'm not going to impale you or anything. But it's going to be tested to make sure you can feel sharp and dull. So like I said, just with the cotton test, if you don't feel anything, let me know. It's going to be just kind of random, so I'm going to get you to close your eyes again. Just tell me what you feel.
You're not sticking me hard enough with the pointy end. Yeah, there it goes.
Just tell me what you feel.
I can tell the difference. Oh, okay, yeah, that hurt.
I'm sorry. You can differentiate between sharp and dull, correct?
Yes.
Okay, I'm gonna sharpen this side. So can you just tell me what that one is?
I feel like you just did dull like 3 times in a row.
Okay.
Sharp, sharp, dull, dull,
Okay.
sharp.
Just want to make sure. Okay, but you can differentiate between all of those that I just did. Okay. Alright, so hopefully we're about done here. Try to keep you too much longer. But there's this one test. Can I get you to test rapid movement? Okay. So what I want you to do is just like so. Okay. I'm just making sure that you can do that. Alright. So I need to check the accuracy of movement. So I want to do 2 things. I want you to take your finger like this and just bring it to your nose. Okay, can you do it with the other hand? Okay. And then I want you to just come and touch my finger. Okay, with the other hand. Alright. Now I'm going to test your, I'm going to see you walk in. Basically your movement. I need to look at your gait and the way you walk and make sure that there's no instability or anything, okay? So I'm going to move these chairs out of the way. And what I want you to do is I'm going to be here and I want to watch you. You can do heel to toe to the door and then just walk normally back, okay? And I'm going to watch you. Oh my God. This is horrible. Okay. Then you just walk normally back. Okay? And now I'm going to do a test called the Rosenberg test. And what you're going to do is you're going to come here and you are going to kind of just close your eyes, and if you want to come over here for me, just kind of close your eyes and stand. And what I'm going to do is I may give you a slight little push just to see and watch your movement, okay? To make sure there's no swaying, you can keep your balance. And this is checking all of your just neurologic aspects. So just making sure that, you know, your balance is good, your cranial nerves intact. Okay, and I'm gonna be right here. I'm gonna brace you, and I'm just gonna see if you can just come back with balance.
I'm supposed to do this.
All right. I'm just watching your balance. Okay, so next you can open your eyes back up, and I want you to do the same thing, but I want you to cross your arms like so. And then I'm gonna watch you with your eyes closed. Same thing, I'm gonna watch your balance. Okay, and then I'm gonna be right here, and I'm just gonna kind of push and just see your recoil back. Okay, this way. Okay. All right. And next, or the last thing for the neuro, what I'm going to get you to do is just balance on one foot, and I'm going to watch how you.
Can't balance at all.
Have you noticed any just trouble with balance, or is
Well,
it's kind
that
of
was
just
my
hard to
hurt
do?
knee.
Okay, right.
My right foot.
Right. Okay. Okay. So just trouble with that, just because it whenever you put pressure down on it, it just like all of your weight on it, it hurts.
Yes.
Okay. All right. And the last thing I'm going to do is I'm going to inspect your spine and palpate, as well as test your range of motion. And then that will be the last thing that we do. So can I get you to sit back here for me? Thank you. And get you to raise your shirt for me again. Alright, so I'm just making sure your spine is in, midline. There's no curvature, any type of that. So I'm just going to go through here, and I'm going to palpate, and I'm going to make sure I can feel vertebrae, make sure that they're all in midline. When I do that, just right down your spine. There's no tenderness or anything, any type of pain.
Nope, just ticklish.
Okay. Okay. Alright. So it feels very symmetrical. There's no curvatures. The last thing that we're going to do is I'm going to test your range of motion. So I'm going to need you to stand up one more time for me, Mr. Jalovic. Move this out of the way. Okay. So first we're going okay, so what we're going to do is we're going to do flexion. So what I want you to do is just kind of bend over, and you don't have to touch your toes, but just kind of bend over like that. And that's flexion. And then you can just come and just bend all the way back, which is hyperextension. Alright, and same thing with your neck with lateral bend. Just kind of bend one way, and then bend the other way. Okay, and then we're going to do rotation. So keeping your feet still, and this center, just try to turn your spine and just kind of rotate like so, like you're trying to pop your back. Alrighty, and one more thing, Mr. Jalovic, I'm very sorry that I forgot to do earlier. I just needed to finish doing the range of motion for your shoulder. So if you could just do this right here for me, flexion, just kind of out. I'm sorry, I'm in your way. And then just kind of hyperextend them back. Make sure you can do that. So you can do that with ease. Okay. Well, it was very nice getting to know you, and I surely appreciate your cooperation. Thank you very much, and I hope you have a good day, okay?
You too.
Thank you.